Dr. Andos, for that kind introduction, and thank you for the invitation. Thanks for allowing me to be here. If I understood my task correctly this morning, it's to talk about innovation and policy. Does innovation inform policy, or does policy inform innovation? The answer, of course, is it's both, but we might look to just a couple of examples as to why it is perhaps more satisfactory when innovation drives the policy rather than the other way around. But, you know, as we sit here, there's really not much happening right now in Washington, right? And there's not much happening in healthcare. It's kind of a sleepy little backwater of a policy subcommittee that I'm going to chair this term. It's a phenomenal opportunity, and it is a phenomenal opportunity to get things right and to provide for people in a way that has never been provided in the past, or it is also an opportunity where things could get much more dangerous in the days and weeks and months ahead. So that's kind of the challenge that's certainly before me as a member of the subcommittee, as an individual member of Congress, as someone who represents 790,000 people back in North Texas. You know, my life has been in medicine before I came to Congress, and so when I think of things that were like game changers in healthcare, I typically think of things, discoveries and devices, drugs that have been developed and how they have changed medicine. But as you know, we take a step back this morning and just think about over the last 20 years, there were two things that my opinion, profoundly change providing health care for people that actually didn't have a lot to do with things in the laboratory bench. 20 years ago, last August, the Kennedy-Kassebaum bill passed. And although there were a lot of things in the bill, one of the little demonstration projects tucked into that bill was the ability to provide health savings accounts. And in fact, they were capped at 750,000 of those that would be allowed in the term of the bill. I wanted one. I was afraid I wouldn't get my stuff in time to get one of those 750,000 health savings accounts. It turned out I needn't have worried. There were plenty to go around for anyone who wanted them. They were not all that flexible back in those days. There were only one or two insurers in my area that would even talk to you about that phenomenon of a health savings account. But when you stop and think about all the medicine is, I mean, there can be an unlimited demand. I know this. I used to practice medicine. And the barriers that should be placed by the government? Should it be a waiting list? Should it be rationing? Or do you want some sensitivity, some market feedback on the part of, yes, the physician, but the patient primarily, because the patient is the one who I believe should be in control of that situation. And the health savings account is the perfect model to allow that to happen. Last night in the Rules Committee, we were marking up the budget that's going to allow the reconciliation, that's going to allow repeal or repeal plus, whatever comes down the pipe from the committees. And in that, a question was posed by a Democratic member from Florida. I challenge any one of you on this Rules Committee to point to me a year where your health insurance premium went down. And I said, I'll be happy to. It's the day I got a health savings account. My health premium dramatically reduced. And if I had the discipline, some of that money I'm not spending on a premium into a tax-deferred savings account, and again, that was 20 years ago. Over that time span, there's the ability for me to garner a significant nest egg against medical expenditures. I would argue that whatever we do next, I would like to see expansion of health savings accounts as a, not for everyone, but as a fundamental part of policy. I would like to see that happen. Now, one of the things that we're hearing a lot right now, and another issue that came up yesterday, last night, late in the Rules Committee markup, was another Democratic member from Massachusetts said 20 million, 30 million, whatever the figure of the day is, are losing their health insurance. You know, I don't recall that individual being terribly concerned when I was one of the 6 million people that lost my health insurance at the end of calendar year 2013. I had a health savings account. I had a high deductible policy. The president told me it was a junk policy and I had to get rid of it, that he knew better. This is what I was going to have to buy. There were 10 essential health benefits that had to be covered and may not have been covered in the high deductible policy that I had. But where was the concern for people who were losing those policies when the Affordable Care Act implementation happened January 1st of 2014? I will tell you, as the Affordable Care Act was implemented, there was a special deal for members of Congress. I thought that was wrong. The special deal for members of Congress was that we could take a subsidy and walk it into an exchange as long as we were willing to purchase in the D.C. shop exchange. Number one, my doctors are not in D.C., they're back in Texas, so that was of no real value to me. But the other thing was, I knew my constituents at town halls back in Texas would not understand why I, as a member of Congress, got a special subsidy that was untaxed that I could walk into an exchange. So I said, I can't do it. No, thank you. And I went to healthcare.gov and signed up, just like so many other people tried to do that October, December. It was one of the most miserable experiences I've ever had in my life. I was worried that I was actually going to be able to get signed up by the time the deadline expired at midnight on December 31st. And then remember, they extended it for a few days. But it was a tense time for people buying in the individual market. It was the appropriate thing to do because my constituents that I represent who are in the individual market were going through the same thing. And of course, I've heard from a lot of them over the course of time with the Affordable Care Act. Now, 2 or 3 days ago, the president gave a beautiful address in Chicago and talked about how great things were with health care. And you almost feel like you're in a Dickens novel. It's the best of times, it's the worst of times. Look, people are struggling right now under the constraints of the Affordable Care Act, and I view myself as on a rescue mission here to try to help people who have in fact been hurt by the federal policies that have been imposed. But again, the other thing that happened over the last, in fact, 10 years ago last week, I think it was the introduction of the iPhone. Now, you don't think that is a startling medical discovery, but my iPhone can take my EKG. Can't yours? And in fact, this morning, just to make sure, because I read a lot of Twitter reports on the Rules Committee last night, this guy has no heart, so I thought I'd better assess whether there in fact was electrical activity in the myocardium. And I'm happy to report there was. And in fact, on my watch that talks to my phone, there's a little icon that I can actually click on that icon to get the EKG function of the phone, except when I do that, it says, this function is not available in your country. So maybe that's something we ought to work on from a regulatory standpoint. But think how life has changed for people in the last 10 years because of the handheld devices, the phones that we all carry with us. And mine will take my blood pressure, it will take my assessed blood sugar, it'll check my weight, and I'm worried that the NSA has hacked into that and altered it on me. But I practiced obstetrics. Back in the days that I practiced obstetrics, it never failed. 4:30 on a Friday afternoon, a patient would come in her last 2 or 3 weeks of pregnancy with a blood pressure that was just enough elevated over what it had been before to cause some concern. Now here's the problem. Most people who have that it will turn out to not be a problem. It may have just been because I didn't have enough parking places close to the office and she was mad at me when the time the blood pressure was measured. But bad things can happen in that situation also. So if you go the ultra careful route and say, look, you have a blood pressure measurement that is higher than it's ever been before, I need to put you in the hospital for a couple of days and monitor this and make sure something bad is going to happen. And indeed we did that a lot. Domiciliary care late in pregnancy, in order to assess or make sure that preeclampsia was not going to lead to eclampsia and all kinds of bad things down the road. If you guessed wrong and said, well, your blood pressure's a little up, let me see you first thing Monday morning and let's get this checked again and make sure that